Why won't your dentures stay in? And how do they stay in your mouth? To understand these questions, we must first understand retention. Retention refers to forces that keep an upper denture in place when gravity or sticky food might cause it to drop. There are four main factors that help to hold your denture in place. First is the border seal, and in that we have the peripheral seal and post-dam. Next, we have the saliva, muscular forces, and denture accessories. The border seal of dentures is something like how a suction cup on your car GPS or towel hanger in your bathroom works. Any break in the seal leads to a loss of retention and it will fall off. This principle applies to dentures as well. A good border seal of the denture prevents air, food, and water from getting underneath the denture and displacing it from the palate of the mouth. One feature that your dentures can have to create a good border seal is to have a post-dam. A post-dam is a raised border along the back of the upper denture. It applies light pressure on the palate of the mouth to provide an airtight seal. Here is an imprint left on the palate by a denture's post-dam. This feature is a matter of getting used to, just like wearing a new pair of shoes with extra sole support. The next factor which helps to hold your denture in place is saliva. Saliva helps to create the natural suction force between your gums and the denture and is a natural lubricant to make your dentures more comfortable. There are a range of diseases and conditions that can limit your saliva production. Xerostomia is medical speak for lack of saliva, and it's a very common side effect of many medications, medical treatment. Radiotherapy, rheumatoid arthritis, Sjogren's syndrome, the list goes on. If you suffer from any of these conditions, you can try stimulating saliva production by chewing gum or use artificial saliva. The third factor that helps with denture retention is muscular forces of your cheek, which helps to keep the border seal intact and push the dentures in place. This should come as second nature to most healthy and fit individuals, but it can be challenging if you suffer from conditions that cause loss of muscular control like Parkinson's disease or a stroke. Finally, denture accessories can help to improve denture retention as well. Implants can be used to maintain bone levels and increase biting forces. They function as little pegs or stoppers to hook onto your dentures. However, this procedure is expensive and lengthy and not suitable for everyone to get, as you would have to have sufficient bone levels in your jaw. We've also got denture fixatives, which is easily available and affordable for most people and very easy to use. It works by making the saliva more sticky. There's many positive findings correlated to it, like an improved seal, strong biting force, and increased feelings of security and hence confidence. I recommend getting zinc-free fixatives, as there have been instances of zinc overdose reported when people use too much denture adhesive, which results in numbness, loss of balance, and tingling in your feet and hands. If you enjoyed this video, please give me a like and subscribe, as the next video will be talking about how teeth arrangement in dentures can help to contribute to stability as well. Many of my patients tell me that they are so happy that they can hide behind a mask because of COVID. I tell them that this should never be a reason why they should wear a mask. Everyone has a unique smile and we've got to work together to bring that beautiful curve out. Take care and I'll see you soon in my next video.